A major accusation from the Ontario NDP. Leader Marit Stiles says Premier Doug Ford is encouraging private clinics to force Ontarians to pay for health care that should be free. She is calling for a province-wide audit into patient fees, but the government is refusing to comply.
Anyone charging people for health care should be held accountable. Full stop.
And the NDP claims the number of clinics charging patients is growing at an alarming rate.
I can't afford to pay thousands of dollars just to see my family doctor.
Arella Gagnon lost her family doctor this year to a for-profit clinic that charges patients up to $5,000 a year for care, prompting calls for a special audit into fees being charged to patients at clinics right across the province.
We want a full accounting of what these clinics are charging, how much they're charging, who's paying, where is it.
But the PC Majority Public Accounts Committee voting the motion for an audit down this afternoon. And the finance minister claims Ontarians aren't using their credit cards for healthcare.
Let's be very clear that you're using, OHIP is paying for all of that.
In a lot of cases it is with their actual credit card. There's
been
we've documentation of these clinics charging patients for fees that they shouldn't be charged for.
Minister of Health has been clear on that, and we're always going to use the OHIP system. We're funding, and in fact, in the budget, we increased funding for healthcare significantly again.
Do you think the government's in denial, or do you think they know what they're doing?
I think they know exactly what they're doing. This government opened up the door for massive privatization of healthcare to for-profit providers with Bill 60, and I think they've created this crisis.
They're just turning a blind eye to what's going on. That's happening all across Ontario.
The Canada Health Act states healthcare providers can't charge patients extra for medically necessary services. But the Ford government says there is a loophole that allows nurse practitioners to do so. The health minister says she's in talks with the federal government to close it.
I've spoken with lawyers now. I know that this government can close those loopholes here provincially. They could take action on this. They could make sure that actually every single person in this province accesses primary care with only their OHIP card.
And even though there will be no audit this year, the NDP says it's still a possibility for next year. For City News, I'm Tina Yazdani.